edition of Healthy Living, we're going on a little bit of an investigative journey in some suburbs of the Federal Capital Territory, where we'll be asking people who live in these areas if they have access to healthcare, and of course, the condition of the healthcare facilities and the services rendered. As always, I'm Aisha Salihu, and this is Healthy Living.
Providing equitable access to healthcare for every Nigerian is central in the country's National Health Act. But the Nigerian health system ranks poorly in terms of access and quality. The problem of lack of access to quality healthcare is linked with wasteful use of primary care services at referral centers in the rural communities where the burden of disease morbidity and mortality is high. Efficient health expenditure and service utilization may be plagued by the absence of adequately functioning primary healthcare centers, poor or inadequate cost-sharing schemes, among other facts. Let's take a look at a special report on the state of some public health facilities in the FCT.
The health problems for women in Nigeria include high maternal mortality, breast and cervical cancer, as well as issues related to harmful traditional practices like female genital mutilation. Despite the various reforms to increase the provision of health to the Nigerian people, health access is only 43.3%. Political instability, corruption, limited institutional capacity, and an unstable economy are major factors responsible for the poor development of health services in Nigeria. We visited the Mararaba Medical Center to have a better understanding of what healthcare services look like in the hospital, but we were denied free access to film anything or have interviews. However, from what our eyes and hidden cameras could catch, most of the patients there were women and children, and since we couldn't speak to any of them, it is still unclear whether health services are up to standard here. After much persuasion, we were allowed access into the female ward, a somewhat darkly lit room with patients lined up across both sides of the wall. The woman here has been in this hospital for 3 months. Health staff at the facility say she was brought in unconscious and has since been unable to speak or identify herself.
It was on the 17th of September that they brought her unconscious. Nobody with her, it was just the good Samaritans around her, that they found her somewhere, that they were even thinking she was dead. When they went to check, they discovered that she was still breathing. So they now took her to one private school, private hospital in Maraba here. And that private hospital said they wouldn't be able to do it well. They took her to primary health care in Maraba here. Those primary health care too, the staff there, they brought her here unconscious. And since that time, we have been taking care of her. Nobody came to look for her. She was unconscious. Now she could move her. She can move her body. But when you ask her of her body, how well, she will tell you. She will knock her head, but she won't be able to talk loudly. So up till now, we have been interviewing her, and she cannot talk.
The head nurse at the medical center says since the woman was brought in, they have been the ones taking care of her medical needs and feeding her.
Individually, the hospital, is taking care of her responsibilities, and individual people, one like that.
This also takes us back to several unreported cases of unidentified missing people. This is just one out of many similar cases, and often it ends tragically. The Nigerian healthcare system is poorly developed. No adequate and functional surveillance systems are developed to achieve success in healthcare in this modern era. A system well grounded in routine surveillance and medical intelligence as the backbone of the health sector is necessary. Besides, adequate management coupled with strong leadership principles. From the Mararaba Medical Center, we moved to Kwali, where we asked some people questions about healthcare service delivery. This is Kwali, one of the 6 area councils found in the Federal Capital Territory. And it is also one of the places where about 50 primary healthcare centers are spread across Abuja. Now it is uncertain whether health services across these facilities are up to standard, but we are here to talk to community members and to talk to health professionals to know the nature of health services across centers in Kwali. Most primary healthcare centers are usually dilapidated and understaffed, with very little resources at their disposal to carry out duties. However, this PHC in Kwali Area Council seems to be adequately equipped with clinical staff carrying out their work as expected.
This PHC is the headquarters of Kwali Area Council, and we are glad to let the public know that it is accessible and it is also cheap for community members to access. What makes it so? We have a WDC, that World Development Committee, that is working tirelessly to make sure that community members benefit immensely from this facility. And yesterday, the WDC met and we are taking into account of the progress that have been made so far, and the challenges ahead. So that's to tell you that they are always on top of their game to make sure that the people of the community get the maximum health care they needed from this facility.
There are still some loopholes that need to be patched up, and from our findings, some non-governmental organizations have been fully hands-on with helping the clinic.
I think what Aduda did some years back will continue to be in our memory, and as we have rightly said, there are many clinical equipments that is supplied, including chairs, and even then fridge, and other things that he actually donated to facilities within Kwali Area Council. And in terms of other NGOs, they have been supportive, especially with the advent of COVID-19. Some have been providing us with PPEs, and we are grateful to them.
However, there are still people living in rural communities who find it difficult to access good health care, even with the presence of PHCs in their area.
In 2019, there's what we call Basic Healthcare Provision Fund. It is a program that was meant for the low-income earners to access health facility, health services. They were enrolled, and there was a meager grant that was given to some health facility to cater for this. And whoever was enrolled then was given an ID card for such a person to access a facility free of charge. And it covers under 5 years, pregnant women, and adult. But that of adult only covers malaria. That you can as well, if you're an adult, go to any health facility to check for your BP, blood sugar, and others free of charge. And presently, they are trying to modernize it to improve upon what had been in existence, in which the local chiefs or the chiefs were mandated to bring out people that are the vulnerable people in their community. I think it is ongoing now, they will be enrolled, and after the enrollment, there will be data capturing, and such people will be given an ID card, and they are going to, it's a form of FCT Health Insurance Scheme, and they are going to access health care free of charge. And I have to say that FCT had done a lot in this regard, to the extent that there are some people that ordinarily they wouldn't have been able to afford to take care of their health challenges, but with the coming of this health care provision fund, it has actually taken care of the burden of these vulnerable people.
Although with the experience I had with one of my neighbor, you know, when you want to deliver, they will give you some list of pack of delivery, list of delivery, and the period we are in now, you know, men and women cannot afford such fees they are requesting from. So because of that, some women feel reluctant to go. In fact, they may be attending the antenatal, but when it comes to delivery, they will step back because of that requirements. So with the one I'm telling you about, so when it was time, she decided to stay at home. In fact, according to her, that she went some days to the delivery, and they told her to go and do the scan because she had not done it before. So when she went back, she went for the scanning, and they told her to come the next Monday. Before then, she was feeling poo-poo, and before you know, she gave birth while something was worrying her, and she delivered successfully at home. And after that, she took the child to the health center, and they attended to her.
Healthcare delivery in Abuja is, I think, is very, very poor. Because the last time I got sick, I went to the hospital, and the service is not 100% okay for me. Because the other time I went there and I was very sick. Okay, let me put this example to my own sister that got sick. So I took her to the hospital. They were saying, get card, and she was like shivering, you understand? She was even, you know, in a high condition. But they have to get card first before they started treating him. So, okay, getting the card, say, we got to the hospital, they left her, you know, everything was just not okay by me.
The condition of hospital in Nigeria, I'm not comfortable. And what makes us not comfortable, I experienced accident some years ago. When they took me to hospital, I discovered that they don't even give me injection before they start to stitch it. In Gwarimpa here. And by then, according to them, they told me that the hospital is in strike. I had to go to private hospital in Nasarawa State. From Gwarimpa here I had to take a drop down to private hospital where my mother and sister come and took me, because by then I'm not okay. Then they start to treat me there. But then try their best and just stitch my body.
Without anesthesia?
They don't give me any injection. I do expression as appendix. Before operating you or before stitching your body, they had to give you an injection to have no pain a lot. But they don't do that.
Why?
And it's government hospital. I'm the one, not that different person. If you look at my face very well, you know that I have injury in my right side. So it's not something I will just front up. Look at my face here.
In the end, it can be established that healthcare service delivery is not seen in black and white. There are different shades in different places. There are communities with good PHCs and others with PHCs that are not up to standard.
There are actually challenges. One of the challenges is lack of manpower. We don't have enough trained staff. But despite that, we are doing our best to see that we satisfy the clients that come to seek for health services. And one other thing that will be of concern or challenge to us is this epileptic power supply. As I've said, we have a borehole. If there's no power, there's no how water will pump. And as big as this facility is, it will be very, very bad for it not to have water supply. So, and I've said we're advocating especially even the NGOs, that if they can come to our aid and then maybe give us a solar system that will be able to power this our facility.
We took a trip around the FCT and spoke with some Nigerians about their experiences with healthcare service delivery at public healthcare facilities.
I can only tell you of what my experience here at Garki Hospital. Yes, we have been here for more than 2 weeks now, but the delivery is good. They are caring for. I have a grandchild here who has been sick, and they are taking good care of him, and he's responding to treatment. It's a bit congested, a lot of parking problems.
I've only been to Garki Hospital here, so I don't know about other places, but I can say they are trying their best here. On a scale of 1 to 100 or 1 to 10, let me give them 7 over 10. Okay, I think the environment, what else? The staff, if they need more staff here. Then what else? I don't know. It's old. They have old things here. I think they need to add more equipment like the new ones and to make everywhere clean and at least accommodating. Okay, I think the day I came in for my registration, it was really fast. I was surprised it was fast. My registration, seeing my doctor, it was really fast. That I don't know, maybe it was just like that day, but that very day, I had a good time. It was really fast here.
Well, if I'm to rate them 1 to 10, I think they're at 4. They are performing poorly. Though in some specific hospitals like Garki hospitals, that's the Garki hospital here, it's a bit better than what you get in Wuse. In fact, the worst of it all is the primary health care. Because of the equipment they are using, some of those calibrators are old and we give wrong results. And many people have died because their illnesses were not diagnosed on time or they were giving wrong diagnoses. So in general, the service delivery is poor, especially in speed. And most times when emergency cases were taken to most of the hospitals, the procedures and the protocols, take a while. But here, it's a bit better because they will give you at least the immediate first aid and some other medications, even before asking you for doctor's report or asking you for something else. So I understand there's a public-private partnership. I think that is the injection of the private sector into it is what is making the difference.
I think healthcare is, for me, saw an upgrade from the introduction of the PH, because looking at where I'm coming from, the general hospital, that's a specialist hospital, which is meant to help the less privileged and provide almost everything in health. They lacked a lot, but the primary health care, they came in with a new system, going to the hospital and see people welcoming you, see people feeling empathy for you, I just feel it's an upgrade to the system, even though you spend more compared to the general hospitals. So that's my experience with the specialists, with the PHC, that's the primary health care hospitals. And also there's one experience, my wife came home one day, they were coming from antenatal and she said they cooked food for them. I've never seen that to happen in the hospital, so that's one thing I just have to say about primary health care. I think it's an upgrade to our health system.
I'm really not that, I don't stay that much here in FCT, but there was a time I think I visited a hospital in Federal Medical Center. Okay, like their service is not that bad. Like the only time I had issues with them was I think when I went to the lab. Like they were like, I don't know, there is a way they attend to their patients. Like their patients are supposed to be like, you are supposed to attend to them specially. You are supposed to treat them nice, but seriously, they didn't welcome me very well. They were very rude. I don't know why, maybe, sometimes you get up in a bad mood, but even though at least that is your work and you are being paid for that. at least sometimes you are supposed to just have patience in everything. So I don't know. But apart from that, the doctors are nice actually. They're very nice too.
As far as my own personal experience is concerned, I've been to places like Federal Medical Center in Jabi. I've been to General Hospital Asokoro. Then I've been to the one in Wuse. And to be fair to their management, the service delivery was wonderful. The service delivery in terms of customer care services, in terms of accessibility to doctors, and the treatments, it was wonderful. Like for instance, FMC Jabi, I can rate them 8/10. Asokoro, I can rate them 6. Like Jabi, the one in Jabi, they need more personnel. They need more personnel. In fact, even the one in Asokoro, they also need more personnel. Because I will give an instance. There was a day I followed a friend of mine to JSS, to Jabi, FMC Jabi. They were actually, all the doctors around, all of them were busy at that particular point in time. So invariably, by the time they have additional hands on deck, I think it will also improve on their efficiency.
A realization of the deficiencies in the health systems made African governments commit in April 2001 to dedicate at least 15% of their annual budgets to the health sector in what is now known as the Abuja Declaration. The total health sector budget for the last 20 years has averaged below 6% of the total budget. The 2022 proposed health sector budget is 4.97% of the total health budget, miles away from the 15% Abuja Declaration. President Muhammadu Buhari has proposed a capital expenditure of 194.6 billion naira for the Ministry of Health in the 2022 appropriation bill submitted to the National Assembly. For the recurrent expenditure comprising personnel and overhead costs, the President earmarked about 516.6 billion naira, bringing the total budget proposal for health in 2022 to 711.2 billion naira from an overall annual estimated total of 16.3 trillion naira. Although the total amount budgeted for the health sector for the coming year is the highest ever, it is just nearly 5% of the aggregate total expenditure of 16.3 trillion naira proposed for 2022, which falls below the 15% agreed by African countries in 2001. The 2022 health budget proposal of 711.2 billion naira is higher in amount compared to the 547 billion naira earmarked for 2021, but in percentage of the total budget, the latter is higher. The 2021 health budget is about 7% of the year's annual budget total of 13.8 trillion naira, while the 2022 proposed allocation represents almost 5% of the total estimate.
From our findings so far, it is clear that the government and other relevant stakeholders are putting in some efforts towards achieving a standard healthcare system. However, more work needs to be done, just so this standard and quality healthcare system is available, accessible, and of course, affordable by every Nigerian citizen, irrespective of social class, age, and gender. Until I come your way on another edition of Healthy Living, I'm Aisha Salihu.